And I want to thank you again, because we're handing off, because I wanted you to kind of give an overview and kind of introduce Fin trials, and then I'm going to take it a little bit deeper on this next segment here. And so I want everyone in the audience, everyone virtually online, just to kind of give Dr. Morgans a big applause, virtual applause, and also throwing some stuff in there for Dr. Lee. So it was excellent because we want people to understand what the future of prostate cancer is. We're more and more treating prostate cancer like a chronic disease. So it's your responsibility to stay as healthy as do what you can do to control your health and let the docs like Dr. Lee and Dr. Morgans to really help you along your prostate cancer journey. So Dr. Morgans, I really appreciate it. And thank you again for taking time out of your day, your busy day, and Dr. Lee, your busy day, to talk to our prostate cancer survivors, caregivers, and all other folks online. So now, what was very interesting is that it was you recognize how important it is for the doctors like Dr. Lee and Dr. Morgans to have this type of information at their fingertips, clinical trial information. I mean, they may not know everything, but they have a tool like Fin trials to learn more or have easy access. So I'd like to take a second and just kind of drive you guys through this whole concept. Now, this isn't something that's new. The founder of Fin, Thomas Barrington, clearly recognized since the onset that there's a need. I mean, we're talking about to over 21 years ago. Um, um, there's a need for understanding clinical trials because he participated in a clinical trial. So along this journey, we've came up with a concept. There was so much complexity to these clinical trials that we figured out that all you really need to understand your clinical trial or finding clinical trials is what your diagnosis is and where you live. Just those two variables. Very important. So this is the Fin trial site. Um, and as I said before, it has, and shown by Dr. Morgans, you have the ability to see everything by first understanding what your diagnosis is. And below, you'll see your diagnosis. Your whether low risk, intermediate risk, high risk. Do you have metastatic castration-resistant disease? All your major diagnoses are here. Now, if, for example, you have metastatic castration-resistant disease and you live in, let's say, Georgia, we click on that. Now, what this does is gives you all the actively recruiting clinical trials in the state of Georgia. Now, if we wanted to change this from Georgia to go back a little bit and change the state to Arkansas and California, we can do that. We can get this information. So again, our diagnosis, castration-resistant disease, and Arkansas. So now there's only 4 clinical trials there, but you know that there's clinical trials. But we take it a step further because what we want people to understand is that it's complicated, but we keep it simple. That's what Fin does. It takes complicated information and then translate it into a simple form where you can understand your summary, the drug summary, where it's located, even to the point where you want to know where it is. We provide you a map where in the country it's located, the clinical trial site, and how to contact them. So we can go back a little bit. And what was very important is that Dr. Morgans went over clinical trials that you should be aware of. And we want to dig down a little bit deeper because what we create are these patient summaries. We take that complicated information, right? And we create an understandable template or message for everyone to understand. Now, for example, we have AirStep patient summary clinical trial. And I'm going to go through this. I'm going to go through this um, so you understand that this clinical trial is for high risk biochemical recurrence after surgery or radiation. And if your PSA is risen in local treatment, even when the scans are clear, there may be a fast increase. So when we're talking about high risk recurrence, this is a clinical trial for high risk recurrence. Now we're looking at the PSMA PET CT scan. This is very important. And when people call us and we talk about the next stages, a lot of people just say scan. And we want people to understand there's the conventional scan and there's the PSMA PET CT scan. And that's what we want people to understand. So in this AirStep clinical trial, this imaging tool plays a very important role. We know it's a phase 3 study and its investigational drug is darolutamide. And, and it's comparing darolutamide to the standard hormone therapy, which you've heard before, ADT or androgen deprivation therapy. And with which works better, the ADT plus darolutamide or ADT plus a placebo. So I want to introduce this concept of placebo. And no matter what your role in the majority of clinical trials, you're going to get the standard of care. And then in this case, it's with or without the treatment therapy. So in this ARISTEP clinical trial, the participants um, have will fall into one or two groups. You have darolutamide plus ADT. Now, these are pills that are taken by mouth twice a day, or ADT plus a placebo. Again, the ADT is something that would be taken twice a day. Now, treatment is planned for 24 months unless the cancer grows, their side effects are too severe, or you choose to just stop. Please remember, in all clinical trials, you have the right and the opportunity to stop at any given time. So now, even if you have image-guided radiotherapy or surgery may be involved, your doctor will explain all your risks and benefits. Now, this is a very large phase 3 clinical trial because there's going to be about 970 people worldwide in this study. And I mentioned that you're going to take darolutamide, which is about 600 milligrams twice a day. Now, your eligibility, this is not all the eligibility information. But what it is it gives you an idea. You have to be above 18 years of age. Okay. You had to had surgery or radiation in the past, and you have high risk PSA. That's that fast doubling time. Okay. And now there's certain conditions that exclude people, but I'm not going to give you the list here. But what I want you to understand is that if you go to PHEN trials, you'll see a much more complicated list. And for example, if we scroll down, you'll see how extensive our program is, the information that we have for you. But again, we're not going to cover them. I'm just giving you an overview. Um, So when we're looking at this kind of a take-home message, AirStep clinical trial, you can get the information in the chat box. We'll give you the clinical trial site number. We know it's focusing on high-risk biochemical recurrence. We know that darolutamide plus ADT or placebo plus ADT over a 24-month period. Please remember to learn more, go to phentrials.com. And the sponsor of this clinical trial is Bayer. I'd like to go to the next clinical trial. And this next clinical trial is an interesting. There's at the end of our discussion with Dr. Morgan, she talked about immunotherapy, and she made a clear distinction between immunoligand, radioligand therapy, and immunotherapy. And this is a very interesting clinical trial. And this is a clinical trial by our sponsor, Amgen, and it's called the Salute clinical trial. Now, this is for metastatic castration-resistant disease. And the Salute clinical trial, even though it's XALUT, but it's kind of pronounced like Salute. It discusses, it's again for men with advanced prostate cancer with metastatic castration-resistant disease. So you've either heard metastatic castration-resistant prostate cancer or MCRPC. Okay, it's a phase 3 clinical trial. With the investigational drug azaroridamide and with current treatment options. Now, this is a type of immune-based treatment. And it's designed to help your immune system, you heard Dr. Morgan's mention, fight back prostate cancer. In this study, you'll have randomly assigned to two different groups, either the investigational drug, xeritamig, or a treatment chosen by your doctor, either chemotherapy like carboxyl, or an androgen receptor pathway inhibitor like abiraterone or enzalutamide. Now you have a 2 in 3 chance of receiving this investigational medicine or a 1 in 3 chance of receiving one of the standard options. And this is a little bit different clinical trial than what you'll see out there, but it is unique. And your time in this study will last up to 56 months. And this includes screening, treatments, and about 36 months of follow-up. You will have regular doctor visits, physical exams, heart, blood tests. You even take some questionnaires. And you may have some additional scheduling for CT scans, MRIs, or even bone scans that take place about every 8 weeks for the first 48 weeks, and then every 12 weeks. Now, how long do you stay on the treatment depends on how your cancer responds and how you're handling treatment. You know, is the cancer slowing growth death to kill the cancer, or is it cancer slowed up, or are you really managing the side effects? Well, the study related, and this is something that people have to understand that, and we've mentioned it before. These study-related treatments, scans, visits are provided at no cost, and this is why this is very exciting for some people who may not have the funds or the insurance that covers some of these cutting-edge technologies or treatments. Um, and then some of these clinical trial sites will reimburse for travel expenses. So that's why a reason to look at it. If you're interested, so again, we want you to go to the vintrials.com and the Salute patient summary and read more and call us. But you can also, if you want to investigate the site, you can go to this the salsalutestudy.com. And the sponsor of this particular program is Amgen. Now, it was interesting in that Dr. Morgans brought up some other interesting clinical trials. Now, these all are from the same sponsor from the family. It's a MEPRO-1, MEPRO-2, and then a MEPRO-3. And these are very important clinical trials, but they're looking at a different way to approach it. You've had surgery to remove the prostate. You have radiation that kind of damage and kill the prostate cancer cells. You have hormone therapies that suppress the food for the prostate cancer. But now, and also these PARP inhibitors that attack or prevent the repair of damaged DNA. Now you have another therapy that's a whole different approach. It prevents the expression of that gene at its earliest stage. Now, and we'll look at MEPRO-1. Again, in this case, the patients are metastatic castration resistant patients, which are looking for. And we know, though, again, just to be clear, when we start talking about prostate cancer or disease that's moved outside of the prostate, that's metastatic. And so in this clinical trial, you have to have disease that's outside the area of the prostate, surgery or radiation to control it, and have received hormonal therapy, and you're resistant to these treatments. So this stage is metastatic castration-resistant prostate cancer, MC, RCP. Now, scientists have found high levels of this proteins, and Dr. Morgans had mentioned that it's EZH2 in prostate cancer cells. And this high levels linked to resistance to hormonal therapy. Now, this mevrometostat blocks this enzyme, this protein, and can interfere with cancerous growth. So MEVRO-1 and MEVRO-2 are basically are using the same clinical trial. same clinical treatment. And what we wanted to do is just say, cut to the chase, is since she's mentioned it, is that MEPRO-1 is in men whose cancer has already progressed on abiraterone, who have not had chemotherapy since it became castration resistant. And your control or that treatment option will be enzalutamide or docetaxel or chemotherapy. Now, MEPRO-2, again, is using the same investigational drug, this investigational drug that interferes with the EZH2 protein, right? And it's in men who are newly at being diagnosed metastatic castration resistant, have not started any new systemic treatments for MCRPC yet, and everyone gets enzalutamide in this study. So, and then the last group that we want to talk about is is um, the clinical trials that fall in a group of clinical trials that are sponsored by Merck. And these are like the Omaha, or this Omaha 3 and 4, and with another broader earlier on clinical trial. So if we look at Omaha 3, and again, I'll just compare Omaha 3 and Omaha 4 in this. So if we look at Omaha 3, it's a phase 3 clinical trial. It's testing an investigational medicine, and then if I it's MK5684 or over a vasostat. Uh, and and what this drug does is it blocks that protein that in one of the earlier slides with Dr. Lee, and same thing with Dr. Morgan's, there's a protein that plays a role in the synthesis of steroids and testosterone. Okay, and this is interferes with that ability of this protein to make androgens and steroids. Now, if it lowers this, and what they're hoping it will happen is this drug, 5684, um, will slow or stop cancer growth. And again, it's experimental, and it's you have to be 18 years of age. You have to have advanced metastatic castration-resistant disease, and disease that's gotten worse within 6 months after the diagnosis. Now, what's interesting is that you can qualify if you're 18 years of age, right? If your treatments to block the testes with hormones is not working. Now, there are some areas where you won't be eligible if you have a problem with your pituitary function, or have poorly controlled diabetes. But that doesn't stop you from taking the opportunity to look at the website, look at this particular clinical trial. Um, and then the Omaha clinical trial, which is again um, focusing on metastatic castration-resistant prostate cancer. And this is a phase 3 also, using the same investigational drug, which attacks what they call CYP11A1. And again, um, you have to be 18 years of age. You have to have gotten worse. And the treatment with other prostate cancer drugs, including a next generation hormonal therapy, yeah, you already have to have had that. So what I want everyone to do is recognize we have a lot of clinical trials that are available to you. And I wanted you to kind of give you a taste of what's on there, and want you to invite you to take a look at phentrials.com. And then if you have any questions, please contact us, and we would help you navigate these. Now, the next direction that I wanted to go is that we have it's good to know all this science and all these treatment options that are out there, but it's going to be very important for you to hear from the patient, the survivors. And what we feel is they're an integral component of all of why we're here, because we want to assist them on their prostate cancer journey. That's why the speakers are here to assist them on prostate cancer journeys. So I want to bring in our survivors, and that's Mr. Art Kane, uh, Mr. Sherman Womack, and Mr. Chuck Christian.